Good afternoon. This is Barbara Mayetta from 12 Points Wealth Management, and I'd like to welcome you all here today. It is just barely 12 o'clock, so I'm going to give everybody about a minute and a half more to join in. So hang on a second, and then we'll get started momentarily. Once again, this is Barbara Mayetta with 12 Points Wealth Management, and you have joined Understanding Medicare from A to D. And this is a presentation brought to you by 12 Points and First Eagle Investments today. Our Medicare expert today is Derek. As I mentioned, I'm Barbara, and I am an advisor here at 12 Points Wealth Management. I work pretty exclusively with people who are approaching retirement and early in their retirement, at trying to help them reach their dream for their retirement without financial worries. Obviously, Medicare is something that people give a lot of thought to as they're getting close to and entering into retirement. So we're working on this topic with our clients quite often. Derek, let me have you introduce yourself today.
Yes, absolutely. Thank you, Barbara. Hello, everyone. My name is Derek Aya. I am the Senior Coordinator for Education and Policy at the Medicare Rights Center. Medicare Rights is a national nonprofit consumer service organization that works to ensure affordable access to Medicare for older adults and people with disabilities. And thank you for having me.
Glad you could join us.
Right, so for today's presentation, everyone, we're going to review a few different things. First, we're going to try and discuss Medicare basics. Everyone is often coming to Medicare with a different baseline. Some folks have gotten more information than others, so reviewing what it is, what it's about, etc., is how we normally start. From there, what I really want folks to take away from this presentation is some basic information about, all right, I'm approaching 65, or maybe I've already turned 65 and I'm continuing to work. What do I need to know about, what do I most crucially need to know about that transition to Medicare whenever it's going to happen? So understanding Medicare costs and coverage, so you know beforehand, okay, like this is what I would be paying when I move to Medicare from my employer insurance or my COBRA or my retiree plan. Describing Medicare Part D, that prescription drug benefit is really important. And then identifying the differences between original Medicare and Medicare Advantage. As I'll talk about a bit later, these are your two major coverage options. Many folks who are thinking about Medicare already are maybe already on Plan Finder or trying to figure out, all right, I've heard about these three Medicare Advantage plans, or this plan is similar to the plan I'm on now. What should I be going with? Do I do that? Or do I go with original Medicare through the federal government? So trying to give you guys what those differences are so you can better make decisions there. And then last, summarizing Medicare coordination of benefits rules. This is specifically for the folks who are continuing to work past 65 and you're asking yourself, okay, can I stay on my employer insurance? Do I have to take Medicare right now? Does my spouse have to take Medicare right now? Those sorts of questions. But we'll start with Medicare basics. And so the first question, what is Medicare, right? Medicare is the federal program that provides health insurance. There are no income requirements for Medicare. So there's another program with a similar name, Medicaid, which has those income requirements. And then there are two ways to receive those Medicare benefits, Original Medicare and Medicare Advantage. Original Medicare is that traditional program offered directly through the federal government, while Medicare Advantage plans are private plans that contract with the federal government to provide Medicare benefits. So remember, those two options, we're going to talk about them a lot more later on, but those are sort of the big two options for your Medicare coverage. Now, I mentioned Medicaid earlier. Medicaid, again, is a separate program from Medicare. They're both run by the government, but Medicaid is a health insurance program for individuals with limited income and assets. I only bring it up because some folks are eligible for both, but often the two get a little mixed up, and I want to clarify that we're talking about Medicare for older adults and people with disabilities today. So next, it's important to review the parts of Medicare. I think especially I've worked on our Medicare Rights Center helpline for many, many years. And one of the things I often hear from folks who are, just starting to step into this conversation about Medicare is, oh, so I heard about Part A, I heard about this gap supplemental, I heard about Part D. What are all of these things? What is this alphabet soup? Can someone help clarify it all for me? Right? And so the first thing I like to do is really clarify what are these different parts of Medicare. We've got here Part A, Part B, Part C, and Part D. Now, Part A is your Medicare hospital insurance. This is the insurance that's going to cover you when you are formally admitted to the hospital as an inpatient, and cover other inpatient services like skilled nursing facility care or hospice care. And we'll talk a little bit more about what these different terms mean later for folks who need more information there. Part B is going to be that medical or doctor's insurance. So Part B essentially is going to cover your doctor's visits, your specialist visits, preventative care, when you go to the emergency room, anything that has to do with durable medical equipment. So if you need a wheelchair or a walker or anything like that in the future, those things are covered under Medicare Part B as in boy. This part of Medicare is generally covering your outpatient services. So remember, Part A, I said inpatient, which just means you were formally admitted to the hospital. Part B is covering outpatient, which means you have not been admitted to the hospital. Now, Part D, as in dog, that is your prescription drug coverage. This is the outpatient prescription drug benefit. So this is when you go to the pharmacy to pick up medications. With Part D, an important thing to note is that all Part D plans are going to be run by private companies. So when you're thinking back to what I said before, Original Medicare, Medicare Advantage are your big two options. Well, Original Medicare is Parts A and B offered through the federal government, and then someone gets a standalone Part D prescription drug plan, and that's how you have your full coverage. Now, Part C, the part that I skipped, is just another term for Medicare Advantage. So Part C, Medicare Advantage are exactly the same. These are private companies that contract with the federal government to provide Medicare benefits. So a Part C Medicare Advantage plan is going to wrap Parts A, B, and D. It's going to offer the same things that Original Medicare with a Part D plan would offer. The difference is that Medicare Advantage plans can have different costs, different coverage rules, different restrictions. And so when folks are starting to decide between Original Medicare and Medicare Advantage, the things you're going to be looking for are, well, what does original Medicare do in its standard benefit package? How does the Medicare Advantage plan change that? And does that work better for me, or does that work worse for me, right? Now, this very last tier on this slide mentions the costs here. And this is, we'll talk a little bit more about costs later, but just a general, for Part A, most folks are going to have no premium for that. Typically, if you are eligible for Social Security retirement benefits, then you're eligible for premium-free Part A. Part B, this year there's going to be a $185 premium, so you pay $185 a month. Some folks will pay higher, and we'll talk a little bit more about that later. Part C and D, very important, as I said before. Part C is going to vary. These plans cover the same things as original Medicare, but they can have different costs, coverage rules, restrictions, right? And so what you pay for your Part C premium will vary from plan to plan. And similarly for Part D premiums, those are also going to vary from plan to plan. So next, and most of you, I think for a lot of you, this will be more review, but it's important to just mention who's eligible, I think. Again, Medicare is pretty complicated, and so just having a good idea about this is useful. So for folks who are turning 65 or going to be 65 or older, you're going to be eligible for Medicare if you collect or qualify for Social Security retirement benefits or railroad retirement benefits, or if you're a U.S. resident and you meet the citizenship or length of residency requirements. So those are generally the folks 65 plus who are eligible for Medicare. Again, if you have been working your entire life, you're eligible to collect Social Security retirement, then you're going to be eligible for Medicare as well. Folks under 65 can also be eligible for Medicare. Generally, you have to be eligible to collect Social Security disability insurance, be eligible for based on end-stage renal disease, kidney failure, or if you've got Lou Gehrig's disease, ALS, and you've been collecting disability benefits, you can also be eligible. But for this crowd, I think the 65 plus rules are what matters most. So now we're gonna talk a bit more about those Part A and Part B coverage, those covered benefits, and we'll start with Part A's covered services. As I was saying before, Part A provides inpatient or hospital coverage, right? So coverage when you are formally admitted into a hospital. So there are a couple of different things covered by Part A. This list is not exhaustive, nor is what we're going to talk about for Part B, but sort of a general sense of, all right, these are the benefits that I'm getting with Part A. So first, that inpatient hospital care, as I said before, after you've been admitted to the hospital, Part A will start to cover you. Skilled nursing facility care. This is normally short-term, post-hospital extended care. So you might go to a skilled nursing facility after you no longer need to be in the hospital, but you still need some nursing care. Maybe it's wound treatment, maybe it's something to do with like an injury to your, like a knee injury, those sort of things. You may end up in a skilled nursing facility after your hospital stay.
Derek, that's what people might refer to as going to rehab after a hospital.
Exactly. Yes. No. Thank you, Barbara. That's exactly right. What folks are normally talking about when they're talking about going to rehab after hospital is what we're referring to when we're talking about the skilled nursing facility care. Home health care is care to treat illness or injury in the home. And so with home health care, it's very similar. You may have some of the same overlap in services that you can get in a SNF, only at home instead. And so you'll, like, for example, in the case of like wound care, you may come home, you need someone who's able to like both clean and redress a wound or injury that you've had. And so home health care is going to cover those sort of things and often cover a bit of personal care with it. So if someone needs help bathing or dressing, those sort of things, while they also need skilled nursing or therapy services, that'll fall under home health. And then last, hospice care. Hospice care is comprehensive care for folks who are terminally ill, which essentially means a doctor has said your illness has a expected prognosis about 6 months. So the hospice benefit is also available for folks with original Medicare, but it's an elected benefit. So you choose whether or not you want to get hospice and get palliative care, which means you're no longer going to be treating that illness. You're going to instead be receiving pain management care. And then next for Part B covered services, again, Part B is that outpatient benefit. So what we're covering here, we're talking about your doctor services. When you go to the doctor's office, whether it's for getting a physical or a regular checkup, or you're going because you need to go to your specialist, etc., that's Part B. Emergency room visits, preventative care, so care that is going to keep you healthy or prevent illness. This normally means things like vaccinations, like screenings, those sort of tests to make sure that you stay healthy. Home health care, you'll notice that home health care is covered by both Parts A and Part B. And so with the home health benefit, whether or not you're using Part A or Part B really just depends on whether or not you left the hospital recently and you're getting home health care after a hospital discharge, or if you're getting home health care and you did not have a hospital discharge. Again, I want to be clear, I'm going into detail about a lot of these things. These are not things that you need to memorize, right? I don't want you to walk away from this presentation asking yourself, okay, do I remember when home health care is covered by Part A versus Part B? It's more so knowing what your Medicare coverage can do for you when you're enrolling, especially because all of us have had health insurance probably most, if not our entire lives. And so knowing, okay, what's different about my Medicare insurance versus the insurance I currently have can be important as you transition over to Medicare. Durable medical equipment, again, that is the wheelchairs, walkers, those sort of things that can help you move around in your home. And then emergency ambulance transportation. So when you need an ambulance to get to the hospital. Now, there are also many things excluded from Medicare coverage. Medicare doesn't cover everything, and that's one of those places where, you know, your current employer insurance, if you're still working, may have services that it covers that when you transition over to Medicare, you may find, all right, I need to figure out what I'm going to do to continue to have some of the services that I used to have covered by my insurance, right? And so routine dental care, routine vision and hearing care, foot care, long-term care, alternative medicine, care outside of the US, personal care. Again, if there's no need for skilled care, so that personal care is referring to help with bathing, dressing, those sort of things. And then most non-emergency transportation. So if you just need a ride to the doctor's office, it's not an ambulance situation. These are services that are excluded from Medicare coverage. So original Medicare does not cover this. Now, Medicare Advantage plans may cover some of these services, and I want to stop to talk about this for a minute because I think this is one of the places where people sometimes get tripped up when they're trying to decide what to enroll in. Two Medicare Advantage plans could both say we cover dental services. However, Medicare Advantage Plan X may cover some cleanings every year. And Medicare Advantage Plan Y might say, we cover cleanings, we cover tooth extractions, we cover dentures, has just a more comprehensive dental benefit, right? And so when folks are often sorting through marketing materials from plans, again, the marketing materials might both say, we cover dental services. But what you want to do is look at the plan's specific information and find out, hey, okay, but how comprehensive is this dental benefit? Does the dental benefit that the plan offers work for me? Both of these plans, maybe plan X, which only covers cleanings, doesn't have a premium for its dental care. And so you're looking at the non-premium on your dental versus a more comprehensive dental that has an additional premium associated with it, and you're thinking about it from a cost perspective. Both plans could also have exactly the same premium, right? And so these are the sort of things that you want to think about as you're approaching original Medicare versus Medicare Advantage, especially for a lot of folks who I know, because I've talked to, again, many of them on our helpline, who are like, oh, well, I really want dental care, or I really want silver sneakers, or any of these additional benefits, which can be extremely useful. But you want to make sure that you know exactly what you're getting when you sign up for your plan. So now, as we move on, we'll talk a bit more about cost, about original Medicare cost. I'll say up front that we're only going to talk about original Medicare costs because, again, Medicare Advantage plans can have different costs from plan to plan. So for Part A and Part B costs, you'll see here there are two columns. Again, for Part B, you've got that $185 a month premium. With Medicare Part A, you're typically not going to have a premium, so long as you have that 40 calendar quarters or 10 years where you worked in the US, we're paying those Social Security, Medicare taxes. Or in the instance that your spouse had that work history. For parts A and B, they both have deductibles. For Part B, it's a $257 deductible for the year. For Part A, how it works for original Medicare is that when you're an inpatient in the hospital, you first meet your Part A deductible. From then on, once you've met that deductible, days 1 through 60, you pay nothing for. So for 60 additional days in the hospital, you don't have to pay anything. And then for days 61 and on, you have a daily coinsurance. So if you need more than 60 days after paying your Part A deductible, then you have to start paying out of pocket. Again, that is how it works under original Medicare. Medicare Advantage plans can set up that inpatient benefit a bit differently. And then for Part B, how it generally works is that Medicare pays 80% of its approved amount for services, and you pay a 20% coinsurance. And so, as an example, say you go to your doctor's office and your doctor charges $200 for whatever check-in or physical you got. Medicare can say, well, our approved amount is $100. And so Medicare is going to pay 80% of that $100 or $80. You are responsible for 20% of that approved amount or $20. So you have a $20 coinsurance. This gets a little different if what I'm talking about is the best situation where you go to a participating provider. That is a provider who accepts Medicare's approved amount as payment in full. There are also non-participating providers. These folks can charge up to 15% more. And so rather than the $20, you would actually end up paying $35 in that case, because even though Medicare's approved amount is only $100, the non-participating can charge you up to 15% more. And then there are opt-out providers. These are folks who don't accept Medicare at all. And so if you go to an opt-out provider, you actually have to pay whatever the full cost is because they don't take Medicare. Opt-out providers are normally folks like who cover services that Medicare never covers. So folks who, like, for example, provide cosmetic surgery services are normal, or like alternative medicine providers. Those are normally opt-out. You normally have to pay out of pocket for that. But some regular providers may also be opt-out. So those are generally your Medicare Part A and B costs for original Medicare. The last point on costs I want to make for folks are, oh, sorry, next slide, for folks is around Medigaps. Medigaps are these supplemental insurance policies that work specifically with original Medicare in order to pay some or all of the remaining costs. So earlier I mentioned it, you've probably heard of like, oh, what's a Medicare supplement? What's a gap policy? All of these different terms to describe this thing that is called a Medigap. Medigaps are not the same as Part C, as Medicare Advantage. These are a separate thing. What the Medigap essentially does is fill the gaps in your original Medicare coverage. So for example, you pay that 20% coinsurance. Normally with a Medigap, the Medigap can pay that 20% coinsurance instead. So when you enroll in a Medigap, you typically have to pay a premium. So you'll have an additional premium every month for it. But then things like those co-pays or co-insurances are paid for. Again, this only works with original Medicare. It does not work with folks in a Medicare Advantage plan. So something to keep in mind, if you need fuller counseling on Medigap policies, contacting your state health insurance assistance program is normally a good idea. Now we're going to move on and talk about Medicare Part D, the prescription drug benefit. So again, what is this drug benefit? So this drug benefit is going to cover most outpatient prescription drugs. Each Part D plan is going to have a formulary, which is its list of covered drugs. So when someone's enrolling in a prescription drug plan, they normally look at the formulary to find out, okay, are all of my medications covered by this plan? And then you can get Part D in two ways. You're either with original Medicare and getting a standalone Part D plan, or you're in a Medicare Advantage plan that includes your prescription drug coverage. Now, for cost, again, Part D costs are going to vary by plan. The plan may have a deductible. There is a maximum deductible set by the federal government as $590. But some plans don't have an annual deductible that you have to meet first. There may be a premium as well. Again, plan to plan. Some plans have a monthly premium, some don't. You will typically have co-insurances and co-payments for each of your medications. And then catastrophic coverage. Some people may be familiar with this more recently as the Part D cap. For everyone in Medicare's Part D prescription drug benefit, there is a $2,000 cap in out-of-pocket drug costs. So after you have paid $2,000 in out-of-pocket, then for the rest of the year, you no longer owe cost sharing for your prescription drugs. Now, there's one last thing I want to say about Part D costs specifically, and that's just a lot of folks, when they're becoming eligible for Medicare, deciding to enroll for the first time, think to themselves, okay, I'm not taking any prescriptions. Do I have to enroll in Part D right now? My advice is normally yes, enroll in Part D. Find a Part D plan that has a $0 premium, so you're not paying for it, and just be enrolled in it. The reason why is because if you delay enrollment in Part D, there is a late enrollment penalty. You pay 1% additional for each month that you were late on delaying Medicare enrollment. So as you can imagine, that cost can build up pretty quickly and make your premiums cost a lot more. So I normally say to folks, it's better to just find a $0 premium Part D plan if you can, or as low as you can, And then once you need your medication, once you start to need medications, if you end up needing them and you need to switch a Part D plan, there are options and times to do that. So drug tiers, I'm not going to spend too much time on this. This is just to give you a general sense of how a Part D plan works. Normally, plans are going to use tiers to price their drugs. So you might have like a tier 1 that's generics all the way up to like your more expensive brand name and specialty drugs at tiers 3 and 4. This is just an example. Plans can have different numbers of tiers with their plans, but just to give you an idea of how Part D drug plans work. And then last on Part D, coverage restrictions. So plans themselves can have coverage restrictions on certain drugs. You could have prior authorization where the plan requires you to get approval first. Quantity limits where maybe your doctor says, oh, you need like 60 of these pills a month, but the quantity limit is 30 a month. Or step therapy where the plan may say, oh, you should be trying the cheaper version of this drug before the more expensive brand name version, for example. With any of these coverage restrictions, normally the idea is to find a Part D plan that doesn't have coverage restrictions for your required medications. That way you just don't have to deal with it. However, of course, there are circumstances where that can't happen or where you need a new medication and that's got coverage restrictions. In those cases, you can appeal. You can request for the plan to waive those coverage restrictions. So there are some ways around them, but ideally you find a plan where you avoid it to begin with. So next, we're going to talk about Medicare Advantage. So again, a lot of what I've talked about so far has to do specifically with original Medicare and then your standalone Part D plan. With this Medicare Advantage plan, you're going to get Parts A, B, and D together. So with Medicare Advantage coverage, next slide, Medicare Advantage plans must cover all Part A and B services. So all of the stuff original Medicare covers, you get through Medicare Advantage. It can also cover some extra services like dental, hearing, vision, as I said before, different supplemental benefits, nutrition services, in-home supports, home modifications, and plans, in addition to all of these things that they cover, can have different rules and restrictions around how they cover it. So typically you will have a network of doctors or providers that you can see. So you want to see your in-network providers. You can be required, again, to get permission, prior authorization, similar to the Part D thing. And there can be different premiums and co-payments that you're paying from one year to the next. So you have to just be aware that the costs are different than they are with original Medicare. This next slide on supplemental benefits for chronic conditions, I won't spend too much time here. It's just a note that not too long ago, Medicare Advantage plans were expanded to be able to cover more supplemental benefits specifically for those who have certain health-related conditions or chronic illnesses. If you're more interested about this, again, contact a counselor or speak to the plan directly about that. But there are some other benefits out there. So when we're talking about considering plan options, original Medicare through Medicare Advantage, we've got this useful table that I think is great because it just gives you a pretty brief matchup of original Medicare and Medicare Advantage. And so with original Medicare, you can visit doctors anywhere in the US that accept original Medicare, which is very useful for folks who maybe travel across the country. Maybe you live in Boston, but you've got family in Florida that you stay with for a couple months a year. You can still go to Florida and get your primary care there, right? With Medicare Advantage plans, you can only see in-network providers, so that's normally restricted to a geographic region. So when you're out of state, for example, you're normally not going to be able to be covered. There are some important things to keep in mind here. First, Medicare Advantage plans will cover emergency care out of network. So you're not ever without coverage entirely. If you have an emergency situation, an urgent need for healthcare, all of a sudden, your Medicare Advantage plan will cover that. And then secondly, there are PPOs, preferred provider organizations. This is a type of Medicare Advantage plan that allows you to go out of network. You just pay a higher cost, right? With original Medicare, you typically won't need referral for specialists. Medicare Advantage plans, it depends on the plan, but some may require a referral for a specialist. Original Medicare, not going to cover those hearing, vision, dental services that many people want. Medicare Advantage plans can cover those things. You've got your standardized Part A and B costs with original Medicare. Cost sharing will vary with Medicare Advantage, so you want to make sure you're looking at those plans. There's no limit on out-of-pocket costs with original Medicare, importantly. With Medicare Advantage, there typically is an out-of-pocket limit. So when you hit that limit, then you pay nothing for the rest of the year. Now, how original Medicare tries to compensate there is that option to purchase a Medigap. When you've got a Medigap and it's paying for your co-insurances and such, then the additional premiums can sort of serve as a faux out-of-pocket limit. It's not a true out-of-pocket limit, but in most situations, ideally, it gets you close to that. So those are some general comparisons. And what I'll say very quickly for folks, questions to ask yourself as you're thinking about original Medicare versus Medicare Advantage. Do you travel often? What types of insurance do your providers accept? Maybe your provider, maybe if you've got a primary care physician you've been with for many years, and that physician says, oh, I take original Medicare and I take these 3 plans. That's an easy way to get started with deciding what plans are best for you. Maybe what healthcare services you need, because again, if you need something like routine vision or dental, your original Medicare is not going to cover that. And then what would the associated costs of the plan be? These are all the questions you want to be asking yourself as you prepare to enroll in Medicare. Speaking of, how do I enroll in Medicare, right? And so for someone who's enrolling in Medicare for the first time, there are a few different options. The 3 different options, and we can go to the next slide, are going to be your initial enrollment period, Part B special enrollment period for folks who are continuing to work past 65, or the general enrollment period. And for all situations, you're going to be contacting Social Security to enroll in Medicare for the first time. Starting with that initial enrollment period, the IEP is a 7-month period when you can enroll in Medicare Parts A and B for the first time. After you've signed up, you can also choose whether or not you want a Part D plan or Medicare Advantage, or get your Medigap as well. And so as an example of the IEP, just so you know how it works, you can go to the next slide. Say Miss P turned 65 on June 14th. She can enroll anytime in any of the following months. So the IEP includes the 3 months before the month of your birth, the 65th birth month, and the 3 months after. And so for someone who's turning 65 June 14th, that means March, April, May are the first 3 months of the IEP. Those are the earliest times that Miss P can sign up, and her coverage will be effective June 1st. If she enrolls in June, then her coverage is effective the first of the following month, and the same for July, August, or September. Her coverage will be effective the first of the following month. So that is the initial enrollment period. That is the ideal time for most people to enroll in Medicare, right when they turn 65, and you avoid any late enrollment penalties. So if you're going to delay Medicare enrollment, then typically you want to be in a situation where you have job-based insurance. If you're continuing to work past 65, then you are able to delay Medicare enrollment without penalty. There are some more complicated rules for if you've got gaps in coverage. We're not going to go over those, but like gaps in your employer insurance coverage, definitely talk to a counselor if you're concerned about that. But generally, if you're delaying Medicare enrollment past your IEP when you turn 65, if you're working or if your spouse is working and you have insurance through your spouse's employer, then you are fine. Now, the third enrollment period that I mentioned is the general enrollment period. That is January 1st through March 31st of every year. You can use the GEP if you miss your initial enrollment period and you don't have a special enrollment period. The thing is, you don't want to have to use the GEP because you will have a late enrollment penalty. Late enrollment penalty is going to be 10% for every 12 months of delayed enrollment for Medicare Part B. So again, that Part B premium is $185 this year. At an additional 10%, you're paying an additional $18 right away. And this is for life. This is a permanent penalty. So for every year that you delay enrollment, you're stacking up that penalty, that 10% again. So typically either use the IEP, or if you're continuing to work past 65, you've got the special enrollment period. Of course, if you need to, the GEP is there. And then related to this topic, very quickly, I want to talk about coordination of benefits. Coordination of benefits refers to the sharing of costs by two or more health plans. So it's for primary insurance pays first, secondary insurance pays after primary. And coordination of benefits is about who pays first, who pays second. The reason why I bring this up in relation to enrollment, again, folks are going to be working past 65, and so they're asking themselves, do I enroll in Medicare? Do I keep my employer insurance? Typically, if you're working past 65 and you've got insurance from your current employer, or your spouse is working and you've got insurance through your spouse's employer, if that employer has 20 or more employees, it is primary to Medicare, which means it pays first on your health bills and you don't have to enroll in Medicare because you've got primary insurance. If you work for a place that has fewer than 20 employees, it is secondary to Medicare, which means it pays after Medicare does and is not required to pay if Medicare does not pay first. So earlier I mentioned that if you continue to work past 65, you have a special enrollment period to enroll in Medicare. However, what I'm adding to that as a layer here is that just because you have the special enrollment period to enroll in Medicare later does not necessarily mean you should delay Medicare enrollment. If your employer is fewer than 20 employees and it pays secondary to Medicare, you shouldn't delay Medicare enrollment. You should get enrolled in Medicare so you have primary insurance. Again, this is one of those topics that I think is a lot deeper than what I'm going into right now. If you have questions about this, contacting Social Security, 1-800-Medicare, your benefits administrator, or your HR department at your employer are all great places to start getting information. Next, income-related monthly adjustment amounts, or IRMA amounts. So for folks, especially for folks who are maybe continuing to work and are in that situation where they need to enroll in Medicare, IRMA amounts increase how much of a Part B premium you are paying and a Part D premium if you're in a certain income bracket. So folks who have higher incomes typically are going to pay increased IRMA amounts for your Part B and Part D. And we've got a chart here that shows what the income brackets are and what the Part B and Part D premiums are for folks in those income brackets. So again, this often is the situation for folks who are continuing to work past 65 and they've got insurance from Medicare because their employer is secondary. And so, but it also occurs sometimes for folks who just who are continuing to work past 65 and want Medicare for one reason or another. So be aware of these IRMA amounts. I'm not going to go through them exhaustively. What I will note on the next slide is that there is an option to request a new initial determination. So sometimes, because with IRMA amounts, they're looking at 2 years prior, your tax returns from 2 years prior. Sometimes, like, I retired, I'm no longer making that income, but Social Security has charged me this IRMA amount. That doesn't seem fair. And in fact, there is this request a new initial determination form where if you're no longer working, or you've got reduced hours, or if you've lost a spouse, or there was a marriage or divorce or anything like that, loss of pension, these are all different life-changing events where you can get your IRMA redetermined. So note that that is an option for folks. And then last, as we wrap up and then I think open it up for questions, I just want to go over a few key takeaways. First and foremost, get a plan that meets your needs. Again, there are so many different options available for folks transitioning over to Medicare. So some of this is just to help you figure out what plan might work for you. Enroll in Medicare on time, whether that's using your initial enrollment period or a special enrollment period, but avoid having to use the general enrollment period unless, again, you have to. Coordinate benefits, again, just keeping aware of whether Medicare is primary or your employer insurance is primary, and then know your resources. And on this last slide here, we've got some resources for you: Social Security, Medicare, your state health insurance assistance program, National Council on Aging, all great resources to reach out to for questions. But speaking of, are there any questions in the chat, Barbara, that we can take a look at?
Yep, there are a few that came in.
Great.
Is there a referral required to get hospice care? Is that something that, do you know anything about that? I don't know whether that falls into
Yeah, so I can talk about that a little bit. With hospice care, it's not exactly a referral that's required. It is this declaration that you have a terminal illness, and your doctor has to make that. So your doctor has to determine that based on your illness, that you have 6 months or less to live based on that illness. And so when your doctor makes that terminal illness declaration, you're eligible to get hospice care. Doesn't matter if of course, you can live a lot longer than the 6 months. It just has to be that based on the illness, it looks like 6 months is reasonable.
Okay. So a couple of questions here on enrollment. If I delay the Part B enrollment, can I delay the Part D enrollment too without the penalty?
Yes. So you can delay Part D enrollment. Importantly, what you want to do is make sure that your employer is offering you creditable coverage. Creditable coverage basically just means that your employer insurance prescription drug coverage is as good as or considered better than what Medicare offers for Part D. Normally, your employer will send you a notice that says, hey, our drug coverage continues to be creditable for the next year. And so long as you have that, you'll also have a 63-day special enrollment period to enroll in Part D once you've lost that coverage. So thank you for that question. That's a good one to remind folks.
And also on enrollment, and Derek, you and I had discussed this too, there's some kind of requirement that your employer has to have more than 20 employees in order to defer?
Yes. So, so generally, if the reason why that comes off as a requirement of 20 or more employees, the 20 or more employees actually determines whether or not your insurance is primary or secondary to Medicare. Technically, anyone working past 65 and who has insurance through that employer is eligible for the special enrollment period. But if your insurance is secondary to Medicare, which means it has fewer than 20 employees, that means you need Medicare to be paying primary for you. If Medicare is not there to pay primary for you, you basically have no health insurance because your employer is only required to pay after Medicare pays. So it essentially makes it such that it's required to be working at a place with 20 or more employees to want to use that SEP later on. The, I'm saying the rule is a little complicated, but generally, yes, you want to be working at a place with 20 or more employees in order to make sure that you're fine to enroll in Medicare later.
Okay. I'm guessing because you mentioned travel. Does Medicare or Medicare Advantage cover international travel?
Right. So Medicare Advantage plans, there may be situations where there are plans that cover international travel. That would differ from plan to plan. You would want to look into that plan specific information. Original Medicare does not cover international travel. However, Medigap plans, those supplements, can cover emergency services outside of the US. And so if that's one of your interests, you would either be getting original Medicare with a Medigap, or you would be finding a Medicare Advantage plan that has some sort of coverage for it.
Okay. If I have to go to an emergency room and then get admitted, is the entire event covered under Part A?
So if you go to an emergency room, for the emergency room visit is going to be under Part B. Part A happens when you were formally admitted to a hospital. And whenever I say that, I feel as if it's sort of a thing that doesn't make much sense to anyone, and it's because it's really just a thing that the hospital does. The hospital says, okay, this person is formally admitted, and suddenly the box is checked and you're an inpatient. You can actually be an outpatient in the hospital, which means that you would be getting all of your services covered by Part B. It is just when the hospital admits you, when they say, okay, you check the box and now you're an inpatient, which has very little to do with what you're medically there for or anything like that. It's just a box that they check when you have been admitted. That's when Part A starts to cover you. So emergency care, always Part B. When you become an inpatient or outpatient, I wouldn't focus too much on that because that is a doctor's determination.
Okay. Can enrollment move between original Medicare and Medicare Advantage? You know, for example, one year I'm on one and then another year I'm on another?
Yeah, absolutely. So for folks who want to change what kind of coverage they have, the probably most opportune time is fall open enrollment. That's October 15th through December 7th of every year. During that time, you can switch original Medicare to Medicare Advantage or vice versa, or swap your prescription drug plans. And so you have opportunities to change your Medicare enrollment. And there are other opportunities to do so. I'm just mentioning the one, but there are some flexibilities around that.
Where can I find a counselor who can walk me through my situation without them being a salesperson for an Advantage plan?
Yeah, absolutely. There are a few different options. The first is your state health insurance assistance program, or SHIP, which you'll see the number for the national SHIP on the screen there. From there, they would normally filter you to your specific SHIP. You can also go to shiptacenter.org or shiphelp.org and find the number to your state SHIP. Some ships also will only do over the phone. Some will also take in person, but that is a federally funded program to work with Medicare beneficiaries to help them make decisions. And so when you're talking to someone from your ship, these folks are not paid by any Medicare Advantage plans. Again, this is a federally funded benefit for all Medicare beneficiaries.
Okay. Okay, a couple of these are repeats, or we already got them. Last one down here, I think, is if you have if you're on a 24-hour admit in the ER, is that still under Med B?
Yeah, again, it's always going to depend exactly on whether or not the doctor moves you to inpatient or outpatient. Why I want to express to folks not to focus too hard on this is because it really just comes down to whether or not the doctor makes the call to admit you. You could be 24 hours in the hospital for ER and it could be all Part B. You could be 24 hours and at hour 6, the hospital admits you as an inpatient and then suddenly it's Part A. It's not dependent on diagnosis or anything you specifically do. It has almost entirely just to do with that hospital's own systems and practices. So know that you're covered one way or another. And I understand why the question comes up for folks because it's, well, am I going to be paying my Part A deductible right now, or am I still in Part B? I pay 20% co-insurance world. The thing that normally do is to have some have a trusted family member or just trusted person who's there to be able to help you navigate that while you're in the hospital and ask. But there's not a guidebook that will tell you, okay, this is when you're inpatient, this is when you're outpatient. That is up to doctors.
Okay, last question, is SHINE the same as SHIP?
Yes, yes. I should have mentioned different states may call their ship a different name. Shine is one of them. In New York, where I am, we call it high cap. The thing to do, again, if you have any questions, the national number is the one that we've left on the slide. You can also go to the website, either shiptacenter.org or shiphelp.org, and you can look up what your ship is there. But Shine is also a ship.
Okay, great. And then we've had a few requests for, can we get a copy of this presentation? And
Yes.
do you want to send it out? You want me to give them my email? How would you like to handle that, Derek?
Yeah. I'll send you a PDF of the presentation and you can send it out.
Okay, so please feel free to email me, Barbara, Barbara, at 12 points. That's the word 12 and the word points written out, .com. And I'm happy to send you a copy of this. And the few people who asked, I have your email number here, or your email here, I can send it to you. But if anybody else wants it, please send me an email, Barbara at 12points.com, and happy to send it out to you. So I think that's it, Derek. This has been incredibly useful. I've certainly even learned a lot on this. So really appreciate your time today and bringing us your expertise.
Thank you so much. Thank you all for having me. Have a great rest of your day.
Thank you. Bye-bye, everyone.